In order to retrieve an inpatient list, simply click on Inpatients, and here you would get a list of all the current inpatients on this date of today. You would see the time as of when this inpatient list was created. You have several options of applying a filter to this list. By default, you would see all the public patients that are currently admitted under your unit. If you only want to see the private patients, just click on Elective Private and click on Go. Here you would see the private patients. In fact, this little tick here determines if a patient is private or not. What is even more interesting, maybe the feature that you can filter by consultant who the patient is admitted under. Simply click on the consultant's name and you would only see his patients. Another very interesting feature is that by default you would see all the referrals that are currently under that are current and that need to be discussed with one of the consultants. So here you would see the patient's name and a diagnosis history, examination and recommendation. You do have the ability to put a location of the patient in order to find the patient when you try to see the patient again. From your current inpatient list, you can simply click on one of those entries and change your diagnosis, or you can put some comments. And currently we use our day-to-day handover notes and put this in the comments for this appointment in this particular thing. So you basically would say, I want to do a CT brain tomorrow. The location here is just an arbitrary string that you can put in there. We currently use it as the ward with a slash and then the ward bed. And here again you see elective private. This would be a private patient. For the admissions, all the other features are not really used so far. However, if we admit a patient via the emergency department, we tick the emergency thing here. Here you would define who the patient is under, and obviously for which unit. Usually you would just admit for your own unit. You have a status here telling you what working status this particular appointment is going. For the current inpatients, the most important tick is that the patient is marked as current. So in order to appear on the inpatients list, you need to have this mark here as current, which basically means that if you want to discharge the patient today, you just mark today, or you just choose another date, whatever, and it even can be in the past. However, as long as you do not mark the patient as done down here, the patient will still be on the inpatient list. If I mark this here as today and save this, and we go back to the inpatient list, go for thanks and private again to see this patient, click on go. You see that as we marked this patient to go today, the program will show us that there is a discharge planned for today, which is basically a little hint for us to do some discharge paperwork. By clicking in any place here in this line, you would load directly the respective appointment that you are working with. However, if you click on the patient's name right here, you would go directly to the patient's file, i.e. here. This would be the same as clicking on patient file over here. Same thing. If you want to change the admission details for this patient, just simply click on admission. So all the inpatients, or the inpatient list, is generated by appointments with the category admission. And with the status as marked current. Let's go back to the current inpatient list. Another little thing that I want to draw your attention to is a little action button right here. You can put a task in there and just mark things as a little to-do list. But what is even more convenient is that you can load the PACS system directly from this area here. Now, as I'm sitting at home at the moment, I can't really show you this facility. It's basically just a link to the hospital's PACS system, giving the system username and password, as well as the patient's UR number, as you can see up here.